When the first ACO regulations came out, obviously most people had some interest, and we did. And then when Premier decided to do the collaborative, it appeared to us to be a way we could kind of dabble our toe, learn from other folks. It's got collaboration, got partnership, and help us educate us, really, ourselves, our medical staff, our board, as to what the new world might look like.
It's not just about leveraging the shared knowledge, but it's also taking that knowledge, assimilating that knowledge, and that's what the Premier staff that are so engaged and so knowledgeable, that's what they do. They take this knowledge, they assimilate it, they identify what are the key issues and what are the key strategies that you need to take, in this changing healthcare environment.
I think obviously probably the thing that was at least the most helpful to me in my position is the assessment that was done. So, they spent time with our folks and kind of gave us a roadmap to say, these are the areas that you do pretty well that you might want to leverage, and then these are the areas that you need some work to develop them. And so it gave us a roadmap to strengthen those things that we were weak in.
One of the things it did was really give us more opportunities and highlight where we could work, especially in strengthen relationships with our medical staff, to begin to make a foundation to prepare ourselves for an ACO. So it really did, the assessment was very, very helpful. I think one of the things it's done is, again, allow us to learn from other people. That's one of the things we like to do, and see what they've experienced in their environment and take some of those and apply them to ours. So it's been very helpful to have the peers to talk with.
I would say that, again, that it brings a whole lot to the table when you have someone who's taking all of this information from all this shared knowledge and assimilating it, and you're able to take that knowledge and use it to develop your own strategy. So, for example, how do you take a single hospital system in rural East Alabama with all voluntary medical staff and turn it into a Geisinger Health? Well, the answer is you don't. But there are building blocks that you can take, and as we move toward, where healthcare has taken us, and I think being a part of this collaborative can and interacting with the other systems that are doing this and seeing what they're doing, you can learn from those experiences and start your own strategy and your own building blocks.
I think also, obviously Premier has some very large members that have lots of resources to do lots of things, but there are a large number of members that are not, as Mike said, sort of like us. And for us to really have the ability to go tackle this is virtually impossible. So in many ways, we look at Premier as sort of our research and development. So they, they're reading the regs, they're helping advise, and then kind of with the collaborative, you're learning from other people that are not so much different from yourselves, trying to figure it out, and then with Premier's guidance. And then the larger members obviously are feeding to Premier so that everybody can learn and kind of move the train forward.